Good evening, everyone. We still have about 6 minutes. 6 minutes, but while we're waiting, go ahead and place your name. Oh, and your campus too. I didn't put that on your name, your campus. And if I am not your professor, also place your professor's name in the chat. I will let you know when to start the quiz. But you can go ahead and do that. Place your name, your campus, and your professor's name in the chat. We still have a good bit of minutes left, so you still have time to go get water and do a few more things. All right, good evening, everyone. How is everyone doing today? Everybody doing okay? So make sure,
Yes.
great, great. Make sure that your cameras are on. I'm hearing someone's not on mute. Okay. Make sure that your cameras are on. Go ahead and place your name and your campus in the chat. Also, your professor's name if you're not usually in this class. You want to ensure that your cameras remain on at all times, because if it's not on, it's just like you're not here. So make sure that you have your camera on. If you have to walk away, step away, place a message in the chat, but ensure that your camera stays on for the duration of the class. Go ahead and place your name, your campus, and your professor's name in the chat. So I would like to say congratulations. Overall, you all did really, really well on the last exam. Would anyone like to share anything that they did differently, that they found that helped, so that others can just hear, you know, what you tried to, you know, so they may think about doing that for this last exam? Anyone want to share?
I think that the concept form that you put out was very helpful, so we could like hone in and focus on what was important.
Okay, thank you. Anyone else? No one else wants to
I
share?
would pick a little bit from each professor.
Right. So what you're saying is you actually looked at all the different reviews. So those were
I
cool.
sure
You did great.
I did.
Great. They're out there. And so I did mine. I usually do mine early on so students can have enough time to think about what they have to do and can start looking at it piece by piece. So I know at least one review is already out there. So make sure that you're looking at those reviews. I would advise just looking at a few minutes at a time, not the entire review, and just make sure that you are really understanding the concepts. Even if you have a resource that's not supposed to be a resource, make sure that you're understanding why the answer is the answer, why that concept, you know, what you know about that concept. Because the next thing after this last exam is HESI. And so remember, HESI is just a compilation of all of the information and the knowledge that you have, and you just bring it over to the community setting. So make sure you know why the answer is the answer and understanding that concept. Even if you have to walk it all the way back to, you know, what does this body system have to do with this concept? What body system? What is affected? What's not happening? So great. Thank you all for sharing that. So the next thing on our agenda, let me flip back to, is our quiz. Let me just show you the agenda real quick here. So just as a reminder, these sessions are recorded and they are viewed by the attendance coordinator. So just to let you know, to make an informed decision, it's not just us. Someone comes in and looks at these reviews. Share here. Okay, so the next thing we'll do is we'll get ready for our quiz. And we do allow you the 15 minutes. In the event that you finish before the 15 minutes, you can walk away, do whatever you need to do, but just make sure you're back. I'll usually put a timer on the screen, so just make sure you're back in front of the camera, but still leave your camera on for that 15 minutes if you finish before time is called. Then the next thing we'll do is I'm going to post a case study in the announcements for us to review our concepts for this week. So we will actually go to small groups and look at that. Then we'll come back as a whole group and make sure that we really understand what the concepts are for that case study. And then at the end, we'll let you all do some talking. We'll let you all do some presentations of your PowerPoints. Hopefully we'll be able to do all of them today. If not, we'll catch the rest of them on the end for next week. So that is our proposed agenda. We do know things might change. So without further ado, let me stop sharing. If you would go ahead and log in and go ahead and take your quiz, ensure that your speakers are off on mute during the entire 15 minutes. If you need to talk to me, make sure you communicate via chat. I'm going to stop sharing and I'm going to actually place myself on mute. Go ahead and begin the quiz. Okay, so our next thing on the agenda is in the course room, I actually placed under the announcements, I placed a case study. So I'm just gonna randomly place you in groups. Let's see here. Zoom will just manually put you in a group. And so open up that case study, read through it, identify the concepts from your assigned readings and from your prior knowledge from other courses. And there are some fill in the blanks. There's some true and false. We have Jerry. He is one of 7 nurse managers from Longleaf Home Care Agency, and he's going to take you through this conversation with him and Mary. There's some other characters in the case study also, but just read through it and see if you can identify things that are correct, and if they're incorrect or they're false, identify what would make it true. Identify those concepts that it's talking about in reference to home care, long-term care. And so we will randomly put you in groups, open up the case study that is found in the announcements. If you can't pull it up, I'm sure someone in the group can. And we'll give you all a few minutes just to talk it through, and then we'll bring you back to whole group and we'll discuss it all together. But ensure that you read through it and see if you can identify the concepts that's being discussed, and that you can fill in the blank or answer the questions as you read through the case study. And if you're having problems answering it, those are probably going to be the your starting point of the things that you need to start reviewing for this next exam. So accept the invitation to go in the breakout room. We'll set the timer for 12 minutes, and then we'll bring you all back to whole group and we'll discuss. Let me set my timer, accept the invitation. It should be coming to you. Then I will come around to each room just to listen in. Make sure you're having a healthy conversation regarding the content and concepts. Danielle, did you get the invitation? McGill, are you there? Ms. Manner? Did the invitation pop up on your screen to go to the breakout room?
What was the first question again?
Okay. It says in the community health nursing, especially home health, blank system is most
every hour. We did not put any type.
Let me see what QPS setting is. I don't think those two are the same, but I'm about to check to make sure. Cause I would think I lost my internet connection. I have to log back in.
That was horrible.
All right, everybody's coming back in. So how did it go? How do you think it went? Do we know, understand what they're talking about, or are these just new information for you in the case study? Is it brand new information, or is it spot on with the things that you've been reading, or is it way off? You've never heard it before. Let me hear from you. Who's gonna be our leader with the case study? Are you volunteering, Ms. Hopper? You and Ms. Williams, are you all volunteered to lead us through the case study?
I didn't understand it. Like it was just, I don't know. It was confusing to me. I mean, we got a lot of it, but it was still kind of confusing.
I think everyone is back now. Okay, so here we go. Who's gonna lead us through it? Or you all want me to narrate through it? Now you all gonna have to answer the questions and talk about that, and I'll just validate what you're saying is correct or not. Let me pull it up on the screen here. Okay, this is it right here. And let me share. Okay, Jerry is one of the 7 nurse managers for Longleaf Home Care Agency. Mary, the new nurse, is riding along. She's an LPN. She's riding along with Jerry. Jerry covers a few home health tips and need to know information as they're traveling. They're chit-chatting as they're headed to the patient's home. Jerry says, if it's not documented, it did not occur. Have you all ever heard that? Or is that something new, a new phrase? What have you been told about documentation?
That's true. That's true.
Exactly that.
Document everything.
Yeah, you have to document everything.
If you didn't document it, it didn't happen.
Yep.
Great. Documentation, good, bad, or ugly, put it down, place it there, because in the event that something happens, hopefully you don't, but if you're on that stand and they ask you about what happened, they're going to, even if you think you have a beautiful recollection, you knew what the weather was that day, you could tell remember what you had on, they're going to still provide doubt in your memory, but they cannot provide doubt in the things that you've documented. So documentation is a written account of what actually happened. Okay, so Jerry and Mary, they're in the car, they're going on down the road, they're chit-chatting. He says documentation is very important. Documentation is a written account of what happened. Documentation is very important for client safety, for reimbursement, for etc. Documentation is needed for just so many things. In community health nursing, especially home health nursing, blank system is most relevant to home health nursing documentation. It is most typically used by home health nurses. So a group of nurses got together and they named this system after them. And so this system is used for more than home health nursing documentation, but essentially it was created for them. What's the name of that system?
Oh.
It guides their documentation.
Yeah, Mark.
It's the Omaha system.
Omaha system, right, OMAHA.
HF.
Yeah,
Mhm.
Omaha
It's
system.
Omaha system, yeah.
So what do we remember about the Omaha system?
Mm,
Do we remember? I'm not sure exactly where it actually happened, but I guess maybe in Omaha. But anyway, so we got these nurses, they got together, the Nurses Association, and they were like, hey, we need some type of guidance or something to kind of help us capture everything, because they did know that documentation was very important. And so they got together and they created this system for documentation. And it is mostly widely used for home health nurses. For those of you that are working home health, I mean, of course, whatever you're using to document didn't say Omaha, but they actually provided the guidance for those tools and the resources that you're using to actually capture what you're doing for those patients. Anyone else remembers anything else about the Omaha system? Okay. Let's move on. While technologies have been simplified and their reliability have increased, facilitating their safe use in the home, the incentives and pressures for cost control, because they were giving out, the government were giving out incentives, whether it be monetary or some other type of incentives, whether it allowed them to get more resources for things that they were doing, some type of incentives. And as a result of that, the pressure was on. Okay, we need you to control your costs. Technologies have improved. Right now, people are doing dialysis at home. They can monitor their blood pressure at home. They are doing glucose checks, finger sticks. If a person is in a long-term care facility and they need an x-ray done and it's not emergent, actually there's a little, in our area, I've only seen this little white van, and it's not the same size as like the regular vans, but it's this different type shape van. It comes to the places and it actually do x-rays, EKGs, a number of different procedures right there where the people are at. They don't actually have to go to the hospital to get those things done. So technology have allowed us to improve healthcare. The incentives and the pressures for cost control. So government say, hey, we've got all this stuff invented. We're allowing you to do this. We've supported you with money. We've supported you in resources. Need you to get a handle on your costs. The incentives and pressures for cost control and improved health outcomes have decreased or increased the development and use of telehealth technology in home care. Which one? This is what we're looking at right here. Read this statement. The incentives and pressures for cost control and improved health outcomes have decreased or increased the development of the use of telehealth technology in home care. Think about, yes, exactly. Increasing about what I just told you. Just think about even before the pandemic came about, but for sure once the pandemic came about, and now, even now, you can have your doctor's visit in your home. You know, you don't really have to go to that doctor's office for certain things. Now we're actually working on one of our projects is, one of our target areas is sleep studies, sleep apnea, sleep disorders. So there has been a device that has been created and designed, has been approved. And for our participants, we're sending out this device. Well, we will be sending out this device once we get everything situated, all the ins and outs of it. Person will wear the device on their finger for 5 nights. They'll download the app, wear the device on their finger, answer some questions in the morning when they wake up, turn the device back in, and the doctor will review their activity that they have those nights that they slept with the device on their finger. And it will be determined whether or not they have sleep apnea, if they have other sleep disorders, all in the comfort of their home. The only thing they have to do is have a phone that they can download the app, and the mechanism of getting to and from the post office, getting the device back. And so just think about that compared to, let me call the doctor's office, get an appointment. I need to take all my stuff to go sleep in a lab, in the lab or wherever they have for the people to sleep at. And then it may or may not have a good reading. Then you may have to get rescheduled. Now, this device is not going to take the place of that, but there's an alternative. So it has increased the development of the use of telehealth technology in home care. Anybody have anything else to say about that? We understand that concept. Your doctor's office, they still charge you the same price too. They don't go down just because they're doing well, my experience, they have not. It's the same little copay and everything if they're if the visit is done in your home. But it has increased that technology in telehealth. All right, here we go. Jerry states, discharge begins on what?
Admission.
Admission.
Great. Even if by the time they get discharged, their status has changed, some of the resources that you have identified that they need, they might not need, you might need to identify some different type resources, but you should start, the nurse should start thinking about discharge when that person is admitted. Great. Mary asks, do we provide direct care and collaborate with other disciplines? What should Jerry's response be? You got 4 responses right here. Which one of them that you all select?
The third one.
Anyone else?
We also chose the third one.
Mm-hmm.
I
Okay,
think so as well, because there's a lot of interdisciplinary working parts as far as the discharge.
tell me more. Who are the interdisciplinary people? Like what, for
Like if
example?
you need occupational or PT or speech therapy, if they had a stroke and they're dysphasic and they can't eat, you need to reach out to other interdisciplinary groups for that particular client or patient.
Okay, did anyone select anything else? So do we all agree with them? Yes, the nurse still provides direct care for the client. However, interdisciplinary collaboration is necessary to prevent fragmentation of care. Okay, so we agree. And also, it depends on the patient's insurance, depends on what documentation, because there are some insurances, I want to say, I can't think of it right now, but they want to see almost daily records of the nurse's documentation or the therapist documentations to determine whether or not they want to still pay for those therapies for that patient. And some of them are really, really more stricter than others. So it takes all of that, the PT will let the nurse know, hey, this person, I think they've reached their maximum. We're getting ready to stop services. You might want to get a family member or somebody else to teach some of these things, because based on what we're finding, we have to actually stop services. And also because of the documentation, the insurance is going to stop paying for them to come to the home anyways. So yes, I do agree. The nurse still provides direct care for the client. However, it does take that collaboration to prevent that fragmentation of care. Okay. Mary asked another question. Can we assign the aid or patient that is unstable?
No,
No.
Why?
We said no too.
Why you say no?
Well, I said no because I feel like the UAP is not, she's not qualified to take care of this patient. And I know I need to pay attention more. Like this patient requires more care. So, and like, well, no, I don't want to skip it, but yeah, that's why.
So what word in there throws out? Which word, what's the key word in here that makes you say she's not
Unstable.
unstable? That's correct.
Mm-hmm.
Yes, that's the key word. If unstable, no, you do not want to assign it to unlicensed personnel. Great. Mary states, I know we could not could not assign a task for a patient that was unstable to an unlicensed person. We worked in a long-term care facility, those like your nursing homes or in the hospital. We had to replace throw rugs, and slip pads. So settings, for the most part, they're kind of, I don't want to say outlawed, but throw rugs are just not good for those type settings. Because you have people moving around, they're in unfamiliar places. So what you'll see is these non-slip pads. Make sure you understand that. Throw rugs are a thing of the past. And so even if in their own homes, especially if they're considered a fall risk, you want to encourage them to replace with non-slip pads. That's the key point, you all, non-slip pads. Okay. Marriage is rattling.
Linda, turn your camera, your thing off.
I got it. I turned it off for it. And marriage is going on and on and on. I also remember we had to cover a reddened area over the coccyx that does not blanch with a transparent film dressing with a tourniquet every hour. We did not put any compress, hard or cold on it. Do we agree with that so far?
No,
Don't
cover it.
Don't cover it at all?
I agree with it.
Yeah, but the patient should be turned every 2 hours, right?
Why is it every hour now? Because what?
Because they have the redding area, that's a stage 1.
Yes,
Yeah.
normally it is at a minimum of every 2 hours, but because you're right, thank you. They have something going on and we don't want it to progress. We want it to go backwards and get better. The reddened area throws out the every 2 hours. So yes, reposition every hour. What about this dressing? It's just, remember, a transparent film, that's just a little thing, I think we call them like opsites. They're real thin. There's no medication in them. You can see the area. It keeps the area protected.
Is it breathable?
It is.
Okay, so yes.
Okay. What about the compress? Do we need to put any type of compress on this area?
No.
No.
Okay. So we agree with Mary. Points. A red area on the coccyx. So we need to turn them every hour now. Every hour. And usually if you go ahead and do these things, you relieve that pressure, keep them turned, make sure that they're eating. Don't put any other stuff on it like a compress, hot or cold. Usually within 24 hours, that red area will start to back blanching and that area will look fine. I mean, it really does. It really will. Jerry states, that is good that you remember those things, important things to provide appropriate care. Yes, we agree with. If it's a reddened area, we can go ahead and place a transparent film on. They pretty much call it opsites. There's no medication or anything in them. They're breathable. They protect the skin. You can also see to see if there are any changes because you see the skin, the area that's up under it. You want to turn them every hour. We do not put a hot or cold compress on those. All right, here we go. When would you delegate care to the nursing assistant? Tell me about the specific things you had to keep in mind. This is Jerry asking Mary about this. And she says, I would give specific instructions as what should be done. Specific.
3.
It's 3.
She also says, instruct how the task is to be done. She says, I had to always keep in mind that at the end of the day, that she was really responsible for the outcome, even though it was delegated. And then she gave the person a list of information that needs to be reported. Like if they go in and the person is stable, this person is stable. Jerry says, what are those things that you would tell the nursing assistant? I give them specific instructions as what should be done, how the task should be done, a list of the information that they need to report. For example, they're going to give a bath. You know, I need you to give a bath. They are total care. Get Bob to help you when you go in. If you see any red areas, broken areas, I need you to report that back to me. So once the bath is given, Mary goes to, what did I just say the lady name was? I don't know, she goes to the CNA and say, hey, did you get the bath? Yes. Did you get help? Yes, I did. Did you see any red areas on them? Oh, I forgot that you said that. Yes, there was a red area on the coccyx. So all of these things are correct. Mary needs to keep in mind that at the end of the day, the outcomes that she is still responsible for the patient's care. And even though she's given those specific instructions about what to do and list the information that needs to be reported, it's still up to her to go back and follow up because they may forget, because a buck stops with the nurse. So all of these things are correct.
Oh, I thought we had to choose. I'm sorry.
That's fine. Read each of the above and determine if you agree or disagree. Do we agree with step number 1? Yes. We agree.
Yes.
Number 2, yes.
Yes.
Number 3, we agree. And number 4, we agree.
Yes, ma'am.
Okay.
Definitely.
Here we go. These are some other characters. Sarah tells Bob, I don't know what this is stuff I just made up, you all, but I was just giving a different way to kind of put it so that we could, I don't know, because people learn differently. So just a different way to address the different learning styles. Sarah tells Bob, reimbursement for home health care is the same for an acute care setting. True or false?
False.
That is correct. It is
Yes.
false. The reimbursement is not the same for home health care in acute care setting. That is false. Okay, then she says, the focus of acute client care is typically on care provided in a hospital, not in a community. True or false? So we're right here.
I have to say that one has me puzzled.
The focus of acute client care is typically on care provided in a hospital setting and not in the community. Okay, so let's go back. So what is the main concept?
I'm gonna say,
here? Go ahead. Go ahead.
I was gonna say, so the acute care is like, it's something that's gonna happen like right then and there. And then being in the community is gonna be something you follow up on.
Okay, so what is the main concept in this statement?
Acute
I'd say,
client
I
care?
think it is true, because true, I think acute care is more for like emergency rooms, things like that.
But
Okay, identify the main
Can't you
concept,
get-
you all. What is the main concept?
is
I don't know,
focused
I put
care on
false.
acute
I put
client?
false.
Can't you have acute care though in a community-based facility though, like skilled units
What is the main concept?
Okay.
or like patients with
Acute care,
Acute care.
Acute care is like
Acute care.
right
So
now.
what is
but
acute?
you can do commute, you can do commute care like in a school, like if a student fall, you can do that.
Acute care is like an illness that's
Right then
happening
and
right
there.
now that's short term.
Exactly.
Asthma,
Yes,
you can.
yes.
It's not long term. It's not
so
a
it's
chronic
false, right?
illness.
Listen to what you're saying. Acute care. The person might
Was it
be in the
true?
school, but are they gonna leave them in the school? Where are they gonna try to get them to?
They take
The
them to the
hospital.
hospital.
If the
Oh,
person's at
so it's
Walmart,
true.
if the person's at Walmart and they are acutely ill, are we gonna leave them in Walmart? Just go ahead and finish shopping.
No.
Acute.
Well, no.
Acute. That's why I was telling you, identify what the main concept is, because if you don't, your mind would, because you all are just so full of knowledge, it will just take you in every drawer that you have all this information. But if you go to acute care, what is my main concept? Acute care.
The sudden onset, like right here now.
Yes. So would this statement be true or false? Typically, care
So
is
true.
where
It's
it is
true.
true. Because it didn't say
That
all the
was-
time, because you all are right. Initially, the school nurse is gonna try to get that baby that inhaler. Initially, the person in Walmart, they're gonna go get the AED initially. And it says typically. Typically.
it's saying that the
That
care is,
person at
it's
Walmart's gonna
saying,
try to keep shopping is what they gonna do. Let's be
They're
real. That
not.
person at Walmart is still gonna go get whatever they get out of that freezer section. Come on, Dr. Ford. You already
I'm
know.
dead. I
Let's
cannot with
be
y'all.
real. You
Look,
already know.
Look, especially if they see that rollback sign.
I was about to say,
You
y'all
know
price
it.
match. Like, for real.
No, but real you are, but for real. So our real response should be, and it says typically acute care is for the hospital setting. Yes, whether or not it's the ER or on med-surg unit or ICU. Yes. So the focus of acute care is typically on care that's provided in the hospital setting, not in the community. So this statement will be true because it's saying acute care is typically in the hospital setting, right? Is this what this statement's saying?
Yes,
Okay, so that's true. Are we clear on that?
yes.
Okay,
Yes, ma'am.
all right. So home health care is provided in the client's environment. They still talking. I think this is still Sarah and the other guy. Home health care is provided in the client's environment, which is the most essential difference between home health care and acute client care.
I think we just answered that.
What is it?
Sorry.
What is it? Home health care is provided in the client's environment, which is the most essential difference between home health care and acute client care. So you would say home health care is provided where?
At the house.
Home,
In
on the
client's
community.
Exactly. Client's environment, at home, tomato. It's the same
Mhm.
thing, you all. Even though we're saying client's environment, that they really are talking about the home, tomato, same thing. Okay.
Okay.
Sarah states, Lisa, the hospital nurse, was in and out of my room in no time. Jerry, the home health nurse, took more time. I wonder why Jerry took so long. What would you say? What would the nurse say to Sarah explaining why there is a time difference?
Could it be that Jerry has more patience than Lisa did?
no, I think Lisa has more patience than Jerry would because Jerry's the home health nurse. So he's like taking his time in their environment with them. But in the hospital setting, they have like 6 or 7 patients.
Oh,
Mhm.
so I was
Yeah.
backwards. Yeah, that makes sense.
I agree with
Okay.
you, Marissa. That's,
And what else?
that's a good
And what
point.
else? And what else?
But it's also more focused if you're going into the home. That
Yeah.
you know that you're going into the home and this is what you're looking for versus being in the hospital. You're like always like on edge looking for something that's
Mhm.
wrong with that patient.
Someone's
There's
knocking
more
at your
time
door.
for patient
I-
team.
I would
So-
also think those two nurses could be performing 2 different tasks.
And
So-
Yeah, and
Yeah,
they
I
also
agree,
don't have
Cynthia.
the same things that you would in a hospital setting than you would with in home health. You wouldn't have those same things that you have access to in a hospital setting with you at when you go to see them at their house.
okay.
You have
and-
more orders to follow too, usually with home health. You have more patient teaching, more medication management. You have to teach them how to do their medication. Usually you have to load their medications a lot of times. You have a lot more tasks to complete.
So think about this, you all. You
But
hear
she
knock,
said,
knock on the door. Someone's knocking at your door. You are at home. Someone's knocking at your door and you're in the hospital.
You got to make sure you put your pants on.
Besides that, you're not expecting any visitors for real.
You hold your dog.
So what has to be established with the home health nurse, which is pretty much already, the presence is already there comparative you're in a hospital?
Trust.
Trust.
that
Yes.
rapport.
Yes.
You can't let not just know anybody in that house. You gotta let the dog not
Exactly.
get you.
Exactly. Yes, because that trust, to be more effective, the home health nurse must earn the family's trust and work in a partnership. That, you know, they letting you in, they see a little name tag, but you coming to my house.
Mm-hmm.
If something goes down, it's just me and you. Whether or not you're in the hospital, people are everywhere, and it's kind of already, you know, that trust is kind of already established because you're in the hospital, you're feeling a little better, you know. And so, key point, takeaway, everything that you all were saying was great, spot on. But I want you to remember, to be more effective, the home health nurse must earn the family's trust and work in partnership. And that's what takes the time, more time. You got to sit down, you got to chit chat with them for a while. They got to make sure, you know, they gonna feel you or not, you know.
They're gonna fill you out before you get to come in their house. period.
Exactly.
You gotta make sure they don't got the bugs too. You gotta inspect.
Exactly. Exactly.
She said,
Dairy states Medicare
Dude,
was a
you gotta be ready
provision.
with that alcohol, ready when you get out.
That's right. Jerry states Medicare was a provision of Social Security Act that was implemented in 1965. The combination of preventative services and illness care followed the introduction of Medicare in 1966. So it hasn't been that long that Medicare has allowed for people to receive these different services. It really hasn't been that long. So, true or false? Introduction of Medicare led to the emphasis of home care nurses caring for acutely ill clients and the increased demands for intensive documentation. Who in here has worked in home health before? Tell us about that documentation. Is this true or false?
True.
True.
It's true. So yes, Medicare allowed for more care to be provided for people in their homes that had more acute conditions, more chronic conditions. But the exchange was you have to, they said, document from here to, I don't know, to Wazoo. The documentation is really extensive. And that might be why the Omaha system was put in place for home health nursing documentation to assist with that. Okay, Jerry is one of the 7 nurse managers for Longleaf Home Healthcare Agents. He's one of the 7. Several of his team members, including himself, have been saying lately, we have been kind of just finding out a lot of needed to know information after we have gotten to the patient's or the client's home. So they've been going into the homes and they're like, what? And I needed to know that before I came here. So this is what he's saying. As Jerry continues towards the first patient or client for today, as he continues to drive him and Mary there in the car, he ponders, what is the most important thing for the case manager from the acute care setting and himself, the home health nurse manager, could do better when a client is transitioning from acute care to home care? What is that thing that they could do? They could do better to help so that, you know, some stuff you just gonna find out anyways, no matter what takes place. But for the most part, if we have effective something between 2 parties, it will assist and make the transition better. We won't be finding out all of these things after the fact. What's that thing?
Communication.
It's sharing. Sharing of information.
Communication.
Yes, communication. So, you know, it does take time to communicate. We call the home health, the case manager of the hospital, you get a voicemail. You know, it does take the time and effort to keep calling back. But at the end of the day, making sure that you actually communicate with them, both parties, lessen chances of you finding out things after the fact. Because then you have to go back, you have to spend more time with the patient, you have to call and identify more resources when you could have already gotten those things lined up before coming. So communication between the 2 parties is going to be key. Communication.
Mhm.
I also think it's important too, like if a family member asks you a question and you don't have the answer, like right then and there, hey, I'll circle back, I'll let you know.
Still saying communicate. Communicate. Exactly. Yes. All right. Jerry, the nurse, arrives at Larry's house, the new home health patient who has hypertension. Larry has also recently experienced a right-sided paresis secondary to a stroke. Jerry and Mary discuss hypertension. So you all tell me, what is hypertension?
High blood pressure.
So what is that?
Is it like, well, I know like the too much sodium and stuff.
So
Blood pressure 140/80 or
Mhm.
greater.
is when those numbers are greater than, yes, than the desired number. So what about a stroke? What is a stroke?
It could be an
Blood clot in the
infarct or
brain.
hemorrhagic.
So there's been a blockage of blood flow to the brain, and it could be because of a bleed, it could be because of a clot, but there has been a lack of blood flow to a part of the brain, which can lead to a person not talking anymore, a person not being able to move the legs and arms. And this, in this case, paralysis. This person was paralyzed on the right side. Okay, great. Jerry tells Larry, home health care is often, so this is Jerry talking to the patient now. Jerry says, home health care is often intermittent. This means, so what are we saying? Let me move this back. So if he's saying it's intermittent, what is home health care? Is it constant or what?
It comes occasionally. It's not all the time.
Exactly. That is exactly what it means. This means that reliance on others is not always possible 24/7. Whoever that is, I'm not sure who, I am hearing an echo, but anyways, we'll move forward. So this means,
Miss Linda, can you turn your volume down?
so this
I'm not
means,
sure it's me though.
that's fine, we'll move forward, you all.
It is, you're the only one that's not on mute.
Okay, hold on, you all. This stays focused. Our little time gonna run out. Here we go. All right, so Jerry says, he tells Larry, home health care is often intermittent, in what you all just said. Home health care people, they're not there all the time. They're not in that home all the time. It's not like being at the hospital. Someone's there 24/7. This means that reliance on others is not always possible 24/7. He says, I will come on Mondays and Wednesdays. The home health aide, Ben, will be here on Tuesdays and Fridays. Is Jerry giving Larry an accurate view of what to expect from the home health care team staff? This is the question.
Sí, señorita.
Is he giving him an accurate view or account of what the home health care staff will be
I
doing?
believe so.
In terms of scheduling, yes. But
Yes.
not a description of like the job, I would say.
Mhm. Yes, they're not there 24/7. For example, Larry says, hey, I'll be here on Mondays and Wednesdays. Ben says, I'll be here on Tuesdays and Fridays. So yes, so he's trying to get the patient to see, hey, we're not here 24/7, and this is going somewhere. Larry states, I feel like I have lost control. I do not want to lose hope. Respond to Larry in discussing what would be best to teach him in reference to his healthcare needs, for example, bathing, toileting, cooking, and etc. Tell me, what would you tell Larry? Keeping in mind that home healthcare is intermittent.
I think I would ask what his expectations of us were, and then find out if he was interested in like PT, OT services, and contact the physician for orders and kind of help out.
Someone else. Thank you, Amber. So
Make sure that he has non-slip rugs in the bathroom and in the shower.
Mm-hmm. Thank you.
Well
Kate.
lit, well lit hallways.
Okay.
Nothing on the staircase.
Days he would like to take his shower, or plan the days he would like to do.
Say that again, Taya. Say that again.
Plan date, like the specific days he'll do his shower, like when the home health aide comes.
Okay. Thank you for
I
saying
was
that.
gonna say that.
Thank you. But follow me now. So yes. So, but what if he's the person that wants to take his shower 7 days a week? What additional? That's a good thing to tell him. What else should you say?
They can make sure that he got the
Family to help.
appropriate stuff that he need, like a shower chair, some grab bars, and they
Mhm.
can practice with him, and then that way, when he's strong enough to do it by himself, he can do
Ding,
it
ding,
alone.
ding,
Or when
ding. Miss M. Williams has it. Yes. All what you
La
are.
family.
Great. Yes, you tell them, hey, we're going to get these resources for you. You know, you want to plan these. We will be here on those days. But hey, let's practice it, because we want you to be as independent and take care of yourself as much as possible. You want to promote that independence. So that is great. So the key thing is you want to promote that independence. for Larry. Identifying the resources that he might need. They may have to come in and install some grab bars. You might have to have him to say, hey, you know, you might want to call on your family members the days that we're not here. So you want to encourage him to take control or to participate in his healthcare. All right, did we make it to the end before the time was up? Yes, we have 7 minutes left. Any questions about that? You all rocked through that.
Dr. Ford,
Okay.
Welcome back, Dr. Ford, for the last 6 minutes.
What happened? I checked out on I only owe you all 2 minutes back. I
No,
wanted to give you like the whole 6 minutes. Not sure what happened, but here I am. Someone was asking a question.
You ran away.
Dr. Ford, I was just commenting on how awesome your class is. This is like very different.
Here we go home.
I
Well,
think she's out again.
And gentlemen, y'all have a good evening.
We are home.
Yes, you are. That it
Can
is because of
we
your
get off?
students. It's because of your team members. It takes part. It takes you all responding, even if it's wrong. This is your safe space. I'm gonna correct you, or provide that guidance along. I'm not gonna let you get too far out there. So don't be afraid of the process. I know it's kind of scary, but I do owe you 2 minutes. But I still have 2 minutes to talk. Ensure that you go back and review my exam review recording. Do like 10 minutes or 5 minutes at a time. And also,
Can we go home?
I have one more minute to talk. 1 more minute to
Look,
talk.
Ariana, you're on the main.
We
And
can't
she's
really
back.
hear you.
Oh, you don't hear
You
me? I got
keep
one more
cutting out.
minute. I got 1 more minute.
She's in there. She's like, I got a minute.
Should give it to me. We're here for ya.
And then make sure that you review this recording. I'll post it just as soon as it converts. You all take care. We'll see you next week.
And she's out. Okay, I'm leaving. I'm
Happy
not.
learning.
Bye.